Good evening. The topic for today is epidemiology, and the doctor we have here is Dr. Naveen Kumar MS. He is a senior resident neurology at JB Pant Hospital, New Delhi. Sir, you may take over.
So you are appearing for part one or part two, can I know? I'm Dr. Naveen Kumar. I'm working as a senior resident in GB Pant Neurology Department. So I have completed my MRCP 3 years ago, and I have completed my USMLE as well. So I'm post MD medicine. So I want to just know about, you just type whether you guys are appearing for part one or part two, or is it preparing for simultaneously?
Part 1, sir.
Okay. So there, there will be around we can expect around 10 questions in part one, and it will be very simple. Like you will be, these are the subheadings in which the questions will be asked. So the first questions will be it will be the very simple question. The topic will be a measures of disease frequency. You will be asked to calculate the incidence and prevalence, the mortality rate. So the second one will be the types of study. So you will be given a study format and asked whether to identify whether it is a case control or a cohort or a randomized control trial. And after that, you will be asked to calculate the risk and effects. So you know the relative risk odds ratio. And then you will be asked about the statistics test, the chi-square, the t-test, ANOVA. You will not be asked about the exact formula or the details, but they will ask you what test will you apply to find the significance in this, whether it is a normally populated curve or a categorical value. I'm just giving an overall idea, and I will dive into the individual topics later. The next topic would be the confidence interval and the p-value, type 1, type 2 errors, and the graphs and interpretation, survival curves, and forest plots. So you can expect around 10 questions. Mostly it will be a simple question, and they will not be expected you to use multiple formulas. You just know what is the formula used for the statistics test, but you will be asked to calculate the risk and effects, odds ratio, and relative risk. So can anyone say why do we do a clinical study? Hello.
Aspirants, please answer. Please, you can unmute your mic.
Why do you want to do a clinical study? Am I audible?
Please, loud, please.
Am I audible?
Excuse me, voice should be slightly raised.
Am I audible?
Yes, sir. Yes, sir.
Sir, can you see, did you hear what I said?
Yes, sir.
Okay. So see, why do we do a clinical study? Just say me some salient features like why do we do it? Because the most of the clinical studies give the evidence to practice. For example, if we are bringing a new drug, to know whether the drug is actually working or not, you have to do multiple studies from a small population. Then you increase the size of the population to find the efficacy and the side effects. So to know whether the drug is going to work, you start with what is the association and the causation. For example, the studies are divided into observational study and the randomized control trials. See, in the observational studies, you just observe the analytical studies, observational studies and analytical studies. The observational studies are further divided into analytical study. The analytical study consists of a case-controlled, cohort, and cross-sectional. Whereas the treatment, this is called treatment studies. So these are divided into randomized clinical trials and non-randomized control trials. In each of these studies, we obtain evidence. For example, in a cross-sectional study, we do study at a particular point of time. So what we will do is that we will go into the community and we will do a house-to-house survey about what is the whether they have diabetes or not. If that is, we are doing about a study about diabetes at a particular point, it is a cross-sectional study. We try to understand the the prevalence of the disease in that particular community at a particular point of time. So that is a cross-sectional study. But the problem with the cross-sectional study is that the cross-sectional studies are done at a particular single point of time. These will give only about the prevalence and not the incidence. For example, if you go into the community and ask the population about whether they have a diabetes or not, it is going to give you the prevalence of the prevalence of the disease. What do you mean by prevalence? What do you mean by incidence? So prevalence is defined as the what is the number of patients have that particular disease at that particular point of time. For example, if you go to a village and see there are 100 patients having diabetes, it is prevalence. So we can say that the prevalence of diabetes is 100. The incidence is calculated over a point period, like over a longitudinal follow-up. For example, you go to the village every month and then you start in the month of January, you see there is 100 patients with diabetes. Now this becomes a prevalence. Then you go on February to the same village and you calculate. Now you see that the incidence of diabetes, the prevalence of diabetes is 110. So meaning there is 10 new patients have been added. There are 10 new diabetic patients. So now this becomes incidence. So if you ask the incidence is 10 per month. So the incidence of diabetes in that particular village is 10 per month. So usually you say it per month or per year, depending upon what you want to interpret and what is the question being asked. So the idea is that the incidence and the prevalence are two different terms, and the prevalence is it is at that particular point, while the incidence is calculated over a longitudinal follow-up. So when you do a cross-sectional study, you go and do the data and sample analysis at a particular point of time. That is a single point of time. So only you can do is prevalence, and you cannot find the incidence. So once you go into a population and there is you get an information that a patient is having loose stools. So now you go to the village and you do a study and you go to door-to-door survey and find out that there are 100 patients or 100 population people are having loose stools. Now you calculate the other data. Like what is the other data? You calculate the age, sex, and what is the working condition, and whether they have home cooked foods or they eat outside. So then you found out that most of the patients who developed loose stools were eating from outside hotels. So does that prove that the eating outside is the causation of this 100 loose stools? We cannot prove the causality. What we can do is that we can see the association. For example, we can say just that the patients who develop loose stools, they were eating outside in a hotel. This is called an association, and you cannot prove the causality. To prove the causality, you have to do the other studies. So that comes because you cannot prove the temporal relation between the exposure and the outcome. So you don't know whether they had the food in the hotel. After 2 days, everyone developed loose stools, or only 50% of the people who ate the food in the hotel developed loose stools. So this cannot be proven. So the temporal association cannot be proven. So we need further studies to prove the causality. So in the cross-sectional study, what you can do is that you can only measure the prevalence, and association, you can get the association, but you cannot prove the causality. So to prove the causality, you go into the other studies. I'll just come back into the this thing. So I'll just touch upon what is incidence and prevalence. So assume that it is a water tub. Okay. See, this is a new incidence. Incidence is that what are the new cases you are getting in that particular community. So once the incidents are piling up, this becomes a prevalence, because prevalence is like that during that particular point of time. So when can a prevalence decrease? Once you find a new drug and you treat the disease becomes cured, then the prevalence is going to reduce. The prevalence is going to reduce when you have a cure. When the patient dies of the disease, again the prevalence in the community is going to decrease because the mortality is increasing. So the mortality will reduce the prevalence, the cure will reduce the prevalence, and if the patient is having a recurrent disease, recurrent loose stools, then the prevalence is going to increase in the community. So incidence will definitely influence the prevalence. Whenever the incidence is increasing, it will increase the prevalence. Whenever when you have found a cure for that particular disease, the prevalence is going to decrease. When the patient dies very soon, maybe because the patient is having corona and the patient is dying fast, though the incidence might be high, the prevalence tend to decrease because the mortality rate is very high. So this is the difference between incidence and prevalence. So how do you calculate the incidence? So incidence, you have to do a follow-up study. Like you have to follow up the particular community every month. Only then you will know that whether the disease, what is the frequency at which the disease is occurring. So the next studies we are going to discuss is the case control and the cohort studies. So cohort study, see in the cohort study, what we will do is that these are the kind of observational studies. So what we will do is that you select a particular, this will be the population. So you select 100 people from a village. Now you divide those people into 50-50. Let us assume that these 50 patients are exposed, they are smokers. And these 50 are non-smokers. So you have a cohort in which 50 patients are smoking and 50 are non-smokers. Then you tend to follow for a while, maybe around we follow it of 10 years. Then you see among the smokers how many are developing cancer plus and how many don't develop cancer negative. Among the non-smoker, again you follow for the same time period and you found out how many develop cancer and how many don't develop cancer. So you're following up, you take a particular sample, you divide the sample into based upon the various risk factor, whether it's a smoker or a non-smoker. Then you follow up the patients for a while and then you develop and you see whether they're developing the disease or not. So this is called as a cohort study. This is called a prospective study because at the time when you start the study, the disease has not yet occurred. So only the exposure is present and then you follow them and you find out what is happening to the patient details. So this is called as a cohort study. Since you're following up these patients for a long period, for a period of time, you can see that how many patients are developing cancer. So this will give you the incidence. So let us assume that out of 100 people, among 50 smokers, let us assume there are 10 new cancers here. So what will become, there will be, the incidence will become 10. So this is how you calculate the incidence. So for calculating the incidence, you need to have a follow-up of the patients. So the incidence can be calculated from a prospective cohort study. Like you need a cohort study to calculate the incidence of the patients. So what exactly can you prove apart from the incidence? What can you find apart from incidence is you can prove the causation because you know that you are dividing the patient into two groups, that is smoker and smoker. So you are very well sure that these people are developing cancers and these people are not developing cancers. In case if you think that the smokers tend to develop cancer more than the non-smokers, now the causality is established. So to prove a causality, you need a cohort study. That you cannot do with a cross-sectional study because the cross-sectional study is at a particular point and you're not following the patient, so you're not sure about the causality. So this is the prospective cohort study. So there is something called as a case control study. So what is the difference between a cohort and a case control? See, in the case control, what happens is that, let us assume that you are working in a hospital. Now the patients, there are some mesothelioma patients are coming to you. Let us assume there is a mesothelioma patients are coming to you. There are 10 mesothelioma patients have come to you. Now you are confused in what you want to know what is the cause of these mesotheliomas. And you know that this disorder is very rare. So now what you do is that you get these patients and then you ask the multiple history. You go back in time and ask the history, what were you doing and what were you establishing, what's your work, or were you a smoker, have you worked in a shipyard building industry? Now the people among this 10, they will say that they will say that, yes, sir, I was working in a shipyard factory. Let us assume that I was shipyard factory, I was working. Some people around this 8 people, let us assume that 8 people are saying that I used to work in a shipyard industry. 2 are saying that, no, sir, I have never worked in any shipyard industry. I was working in agricultural fields. Now what you do is that you go back in time, then you try to analyze what caused the disease. So this is called as a case and control. At the simultaneously, when you get a case, you get a control. So what is a control? Let maybe assuming that in the same hospital, you are getting 10 more patients of assume that they are getting a liver cancer patients. Now this can be controlled, or you can take a normal healthy controls as well. Now you go back in time and then ask whether did you work in shipyard industry. Now they say that they said यहाँ पे what they will say is that mostly they will say that no sir, we only one people have worked in the industry, shipyard industry, and 9 will have not worked in the industry. Now from this what you can say is that the patients who work in shipyard industry tend to develop the disease mesothelioma more common, more frequent than who didn't work. So this is called as a case control studies. Now the problem with the case control study is that the patients will tend to forget a lot of information, like what for the timing they were working, how many days they worked, did they get an off. So the exposure is not very clear in the case control study. Though there is, you can have that this might be causing the disease, you cannot prove it. Again, the causality, if you want to prove case control study, you cannot prove the causality. You need a prospective study or a randomized control trial to prove a causality. You can see association, yes, you can see this. So now this is going back in time. So when can you do a case control study is that when you think the disease is very, very rare, so that you cannot, you cannot do a cohort study. Then you do a case control study. So there is another study which is very confusing, similar to a case control study. That is called as a retrospective cohort. So what happens in a retrospective cohort, though it is a kind of cohort study, now I have this, let us having this is a mesothelioma. Let us assume some other disease like for an HCC. There is the new. Now what I will do is that I will go and visit the healthcare record. Let us assume that there are patients who had hepatitis C positive, hepatitis C negative. I'll go to a hospital registry. Now I will say I will divide the patients into two groups based upon the hepatitis C status. So I will group one into hepatitis C positive, the other group into hepatitis C negative. And then I will see how many of them developed hepatocellular carcinoma and how many of the hepatitis C negative didn't develop hepatocellular carcinoma. Now the disease has already occurred, but I am not going from the disease to the exposure. I'm going back in the time. I go to a data and I check whether I will see the hepatitis C positive, hepatitis C negative, and then I will tend to see how many of the hepatitis developed disease, how many didn't develop disease. So disease positive, disease negative. Now I will see disease positive and disease negative. So this is a retrospective cohort. This is very confusing with the case control study. In a case control study, what we do have, you go back mesothelioma, let us say mesothelioma. You just ask the patient themselves, what were you working? And then you say that then it becomes a case control study. But in a retrospective cohort, you don't ask the patient, you go to the registry back and you subdivide the groups into hepatitis C and negative, and then follow them up what happened to them. So going back in history, and then you are analyzing it. So this is a retrospective cohort. So these are the studies which okay. So I'll just recap about the case control study. It is a retrospective study. So what you do, you go back in time, then you compare individual cases without the disease. So for example, mesothelioma, you compare patients with mesothelioma and those without mesothelioma, and you go to ask history. What was the prior exposure? Now the association, you can see, I told you that proving a causality in a case control study is difficult, but you can estimate the association. So the association is estimated by odds ratio. So I will let you know how the odds ratio is calculated. And then you cannot calculate the incidence or risk directly. And they are prone for recall bias and selection bias because they tend to forget what happened in the past. So you cannot establish then you have a recall bias and a selection bias. So you cannot establish the causality, you can only establish the association.